As we get older, it's normal to think more about our health. After 60, doctor visits and medical tests often become a regular part of life. Many people start feeling like they're living from one test result to the next. You walk into the clinic for routine checkups, but sometimes you walk out with more confusion and worry than answers. Here's something most people don't realize. Not every test we're told to take is actually necessary. In fact, research shows that many older adults go through medical screenings that do more harm than good. Studies from respected medical journals have found that unnecessary testing can lead to false alarms, unneeded treatments, and a lot of emotional stress. It's heartbreaking to think how many people end up feeling anxious or even undergoing risky procedures when they might not need to. After 60, our goal shouldn't be endless testing. It should be smarter testing. This is the time to focus on quality of life, peace of mind, and meaningful living. It's about understanding what truly helps and what just adds fear or confusion. Because sometimes saying let's think twice about a test isn't neglect, it's wisdom. So today, let's talk about 6 common medical tests you might want to question after 60. And number 4 might really make you stop and think. 1. Annual full body scans. Have you ever felt that little spark of anxiety when someone says, you should get a full body scan just to be safe? It sounds reassuring, right? After all, who wouldn't want to know everything happening inside their body? But here's the truth. Most people over 60 aren't told. Those full body scans might actually do more harm than good. Many older adults believe that the more tests they take, the healthier they'll stay. It feels proactive, like catching problems early. But what happens when a scan shows a tiny spot or shadow that turns out to be nothing serious? Suddenly, you're dealing with extra scans, biopsies, and sleepless nights wondering if something is wrong. According to a study published in the New England Journal of Medicine, routine whole-body CT scans often detect harmless abnormalities, things that would never cause symptoms or harm. Yet, these findings lead to unnecessary procedures and stress. Doctors even have a name for it: incidentalomas, accidental findings that cause panic, not progress. Think about it. After 60, your body naturally changes. Not every mark, bump, or shadow on a scan means disease. But once it's spotted, it's hard not to worry. Some people even go through surgeries or treatments they never needed, all because of one scan that was supposed to help. Now, this doesn't mean scans are bad. They can be life-saving when used for specific reasons, like monitoring a known condition or investigating real symptoms. But routine full-body scans, just to check everything, often bring more fear than peace. It's important to talk with your doctor about what's truly necessary for you, not just what's popular or profitable. As one medical expert from Harvard Health once said, good medicine is not about doing more, it's about doing what matters. And that's the heart of it. Before you agree to your next full-body scan, take a breath and ask, what will this test change? Do I really need it right now? Those simple questions could save you from unnecessary worry and protect your emotional well-being, because after 60, your health journey isn't about collecting reports. It's about protecting your peace, your confidence, and your joy in everyday life. So, before you say yes to that next just-in-case scan, remember, sometimes the best care is knowing when to say no. 2. PSA, test for prostate cancer. Let's be honest. Few words make men over 60 more uneasy than prostate cancer. The fear is real, and it's understandable. That's why so many men rush to get the PSA test, hoping it will give them peace of mind. But here's the truth: no one likes to talk about. The PSA test isn't always the safety net. It seems to be the prostate-specific antigen (PSA) test, measures a protein made by the prostate gland. High levels can be a sign of cancer, but they can also rise for many harmless reasons, like an enlarged prostate or a simple infection. Yet, when a test comes back a little high, the worry begins. Suddenly, you're booked for more tests, maybe a biopsy, and waiting for results that might not even mean anything serious. According to research from the U.S. Preventive Services Task Force, USPSTF, and Harvard Medical School, routine PSA screening in men over 60 often leads to overdiagnosis, finding slow-growing cancers that would never have caused harm during a man's lifetime. But once that word cancer appears on paper, most people can't ignore it. They feel pressured into surgeries or treatments that can lead to lifelong side effects, like urinary issues, fatigue, and even loss of sexual function. That's the heartbreaking part. Many men go through physical and emotional pain trying to treat something that might never have hurt them in the first place. The fear of cancer often pushes people to make quick decisions instead of informed ones. Doctors today are shifting toward shared decision-making, meaning they want you to be part of the conversation. Instead of automatically saying yes to a PSA test, ask your doctor, "What would happen if I don't take it right now?" Or, "What will we do if the result is slightly high?" These simple questions can open the door to better, calmer choices. It's not about refusing tests. It's about understanding their purpose. If you have symptoms like frequent urination, blood in urine, or pelvic pain, yes, testing makes sense. But for many healthy men over 60, routine PSA checks might only add stress and uncertainty without real benefit. After all, true health isn't about chasing every number on a report. It's about balance, peace, and the confidence to live without unnecessary fear. So before rolling up your sleeve for that next PSA test, pause for a moment. Ask yourself, am I doing this out of fear or out of understanding? Because sometimes knowing when not to test is the smartest kind of self-care. 3. Mammograms. After 60. For many women, getting a mammogram feels like a lifelong duty. From their 40s onward, it becomes a yearly routine. A mix of anxiety, hope, and relief. You wait for that letter or phone call that says, "Everything looks normal," and you breathe again. But here's something many women over 60 never hear. At a certain point, routine mammograms may start to cause more worry than benefit. It's a sensitive topic because breast cancer is one of the most feared diseases among women. The intention behind screening is good. Catching cancer early saves lives. But after a certain age, especially when you're healthy and not at high risk, the benefits of annual mammograms start to shrink, while the risks quietly grow. Research from the Cochrane Database of Systematic Reviews and the National Cancer Institute shows that mammograms in older women often detect very slow-growing cancers, ones that might never cause harm in their lifetime. Yet, once found, these silent cancers often lead to biopsies, surgeries, radiation, and months of emotional distress. In fact, studies suggest that for every life saved by screening, several women go through unnecessary treatment for conditions that would never have progressed. Think about that for a moment. The fear, the sleepless nights, the waiting for results. Many women describe those days between a suspicious mammogram and a follow-up test as some of the hardest moments of their lives, all that anxiety, sometimes for something completely harmless. Of course, this doesn't mean mammograms should be ignored. If you have a family history of breast cancer, new lumps, or changes in your breasts, testing remains important. But for women in their 60s, 70s, and beyond, it's worth discussing with your doctor whether yearly screening still makes sense, or if spacing it out, or even stopping, is safer for your overall well-being. Doctors now recommend a more personal approach, one that considers your health, risk level, and feelings. Because you are not a statistic. You are an individual with your own story and priorities. As one medical researcher from Harvard put it, the goal of screening isn't to test forever. It's to test wisely. So, if you're sitting in that waiting room again, wondering if it's time for another mammogram, give yourself permission to ask questions. Ask what's right for your age, your health, and your peace of mind. Because sometimes, the bravest choice isn't another test. It's trusting that your health decisions can be guided by wisdom, not fear. 4. Bone density scans. Here's a question many people over 60 don't think twice about. When was your last bone density scan? Doctors often recommend it as part of aging care, especially for women, and it makes sense. Nobody wants to face the pain or fear of a sudden fracture. But here's the surprising truth. Getting bone density scans too often can lead to more confusion than clarity. After 60, bone health becomes a serious topic. We hear words like osteoporosis and immediately picture fragile bones and dangerous falls. Naturally, that fear drives many people to repeat bone density tests every year, thinking it's the smart thing to do. But according to research from the Journal of the American Medical Association, JAMA, bone density usually changes very slowly, often over many years. That means yearly scans rarely show meaningful differences, and repeating them too often doesn't improve care outcomes. In fact, experts at Harvard Health Publishing suggest that most women and men with normal results don't need another scan for at least 5 to 10 years. Yet, many older adults are told to retest every 12 months, and each time they wait nervously for results that often haven't changed at all. It's unnecessary worry for something that's not changing fast enough to be worth measuring so often. The problem is that frequent testing can sometimes label people as osteopenic or at risk, even when their bones are stable and strong for their age. Those labels can lead to medications that might not be needed, drugs that can have side effects like bone pain or digestive issues. So, instead of protecting health, over-testing can create a new cycle of anxiety and treatment. Of course, if you've already been diagnosed with osteoporosis or have had fractures, that's different. In those cases, bone density tests can help doctors monitor how well your treatment is working. But for many healthy older adults, less frequent scans are perfectly safe and much less stressful. The key is to focus on what truly strengthens your bones: staying active, eating calcium-rich foods, getting enough vitamin D, and doing light weight-bearing exercises. These habits do far more for bone health than an annual printout of numbers ever could. As one geriatric specialist said, testing doesn't make bones stronger, living well does. So before you schedule that next bone scan, ask your doctor, has my situation really changed enough to need this again? You might find that peace of mind comes not from more tests, but from trusting your body's slow, natural rhythm. Because sometimes, the strongest thing you can do for your bones and your spirit is to stop worrying about the scan and start focusing on the life you're still strong enough to live. 5. Colonoscopy. After 60, there's a certain anxiety that comes with the word colonoscopy. Most people don't exactly look forward to it. The preparation, the discomfort, the waiting for results. But we do it because we're told it's important for catching colon cancer early, and yes, it absolutely can save lives. But here's what many people don't realize. After a certain age, repeating colonoscopies too often might not be necessary, or even helpful. For years, medical advice sounded simple. Get a colonoscopy every 10 years after 50. But what happens after 60? Or 70, or 75. Many older adults keep getting these tests, even when their last results were perfectly normal. According to research from the U.S. Preventive Services Task Force, USPSTF, routine colonoscopies after the age of 75 often offer little benefit for people who have no symptoms and have had previous clear results. In fact, the risks, like bowel perforation, bleeding, or complications from sedation, start to rise with age. That's the part no one likes to talk about. The older we get, the more fragile our bodies become, and procedures that once felt routine can suddenly carry real dangers. Yet many seniors still feel pressured to keep up with testing out of fear of cancer, fear of missing something. It's completely human to want reassurance, to feel safe. But health isn't just about scanning and testing. It's about context. If your past colonoscopies were normal and you don't have new symptoms like blood in your stool, weight loss, or changes in bowel habits, repeating the test too soon may not give you any new answers. A major study from JAMA Internal Medicine found that a large number of colonoscopies done on older adults were classified as potentially unnecessary, With no clear medical reason, those same patients were exposed to procedure-related stress, financial cost, and in some cases, medical harm, all for tests that didn't improve their outcomes. That's why more experts are now emphasizing personalized screening. Instead of automatically scheduling another colonoscopy, they recommend talking to your doctor about your specific risks, health history, and life expectancy. It's not about avoiding care, it's about tailoring it to your real needs. If you're over 60 and your last colonoscopy was normal, your doctor may suggest longer intervals or even stopping screening altogether. That's not giving up. That's smart, thoughtful healthcare. As one physician wisely said, screening saves lives when done at the right time, but after a certain point, it saves more peace than life. So before you circle another colonoscopy on your calendar, pause and ask, do I truly need it, or is it just habit? Because sometimes, protecting your health means knowing when it's okay to let your body and your mind rest. 6. Heart stress tests. Have you ever been told, let's do a heart stress test just to be safe? The phrase sounds comforting, almost protective. After all, your heart is everything. And after 60, who doesn't worry about it? But here's something most people never hear. Routine heart stress tests in older adults without symptoms often do more harm than good. It's easy to understand why so many people agree to them. You might feel a little tired, maybe short of breath, and suddenly fear creeps in. What if it's my heart? Doctors sometimes order a stress test just to rule things out, but for healthy adults without chest pain or a history of heart disease, that just to be safe test can trigger a whole chain of unnecessary follow-ups. According to research from the American College of Cardiology, ACC, routine cardiac stress testing in people without symptoms or risk factors frequently leads to false positives, results suggesting a problem that isn't really there. Those false alarms can send patients down a stressful path of angiograms, stents, and even unnecessary procedures that carry real risks. That's the scary part. A test meant to protect your heart can actually put it under more strain, both physically and emotionally. Imagine being told your test looks abnormal, then waiting weeks for further scans or surgeries, only to discover your heart was fine all along. The worry, the sleepless nights, the what-ifs, they take a toll too. Experts now emphasize a more thoughtful approach. The Choosing Wisely campaign, backed by leading medical organizations, strongly advises against routine stress testing in people without heart disease symptoms. Instead, they recommend focusing on heart-healthy habits, eating well, staying active, managing blood pressure, and reducing stress. These actions do far more for your heart's long-term health than an unnecessary treadmill test ever could. Of course, if you have chest pain, dizziness, or unexplained fatigue, that's a different story. Testing becomes important and potentially life-saving, but if you're feeling well, constantly repeating heart stress tests can add unnecessary fear to your life, not reassurance. After 60, your goal isn't to chase every possible disease, it's to live wisely, calmly, and confidently. Medical care should help you feel safer, not more anxious. The truth is, a strong heart is often built more by daily kindness to your body than by constant testing of it. As one cardiologist beautifully put it, the best test for your heart is how much joy and peace it can carry, not how fast it beats on a treadmill. So before you agree to that next stress test, just to be sure, take a deep breath and ask, is this really about care or about fear? Because sometimes, trusting your well-being means choosing calm over constant checking. As we've seen throughout this video, not every medical test after 60 is truly necessary. Sometimes, the smartest care isn't about doing more, it's about doing what matters, from full body scans and PSA tests to mammograms, bone density checks, colonoscopies, and heart stress tests. Each one has its place, but they also have limits. Knowing when to question a test doesn't mean you're ignoring your health. It means you're taking charge of it with wisdom and confidence. By applying these insights, you protect yourself from unnecessary stress, false alarms, and overtreatment. You give your mind more peace and your body more balance, and most importantly, you start focusing on what truly improves your quality of life, living fully, moving freely, and enjoying every moment that matters. Remember, you are not alone on this journey. So many others are learning to make smarter, calmer choices about their health, just like you. These small steps, asking questions, staying informed, and trusting your body, can make a big difference over time. I'd love to hear your thoughts. Have you ever been advised to take a test that you later questioned? Share your experiences in the comments below. Your story might help someone else make a wiser choice too. Thank you so much for spending your valuable time watching this video. Take care of yourself, stay kind to your body, and remember, true health is about peace, not pressure. See you in the next video. Until then, stay strong, stay calm, and stay well.